into the room.
Good evening. My name is Dr. Olakayode Komolafe. I'm one of the doctors in this GP surgery. Could you please tell me your full name?
Hi, doctor. I'm Daniel Brown. I'm 30 years old.
Oh, thank you. How do you wish I address you today?
Daniel.
Oh, Daniele, how are you today? What is the exact
I'm
reason
good.
why you want to see us?
I got a message that my son Rick, he's supposed to get a flu vaccine next week. So I wanted to talk about that.
Okay, I see. Well, it is true. Rick is due to his flu vaccine. Do you know the reason why we give flu vaccine?
Yeah, I mean it's for flu, I know, but yeah, I'm not really comfortable with that.
Okay. Before we go into that, let me just spare a minute or two to ask about the welfare and the condition of Rick. Is that comfortable with you?
Yeah, sure.
Okay. Rick is your biological child. Is that correct?
Yeah.
Okay. Could you please tell me how was he born? Was he born through normal vaginal delivery?
Yeah, it was normal delivery, yes.
Okay. So has he had his immunization up to date?
Yes, so far everything that was supposed to be done, I got everything they when they discharged from hospital, they gave me a list. But this flu vaccine alone, I'm not really comfortable with, doctor.
Okay. What about his developmental milestone? Is it developing normally?
Yeah, he runs around, he talks, and he sings and everything. Yeah.
Okay, that's good. Does Rick have any form of allergy either to food or medications?
No, so far I haven't noticed anything.
Okay. So what is the exact reason why you are not comfortable with this flu vaccine?
Yeah, doctor. One of my neighbor's kids, so he had a fit, he after getting a flu vaccine, and yeah, that's really scary for me. I don't want Rick to go through that.
Oh, I understand you. I understand where you are coming from. Actually, there are so many reasons why people may have fit, but we don't know the background state of the boy in question. So it may not be attributable, it may not be due to as a result of this flu vaccine. Do you understand me?
I mean, it was like immediately after getting the vaccine, doctor. Like,
Okay, I understand. The issue is that for some people may have a background uh, issues that may
mhm.
predispose them to have it. For instance, we don't know the temperature of the boy, we don't know his epileptic status. But before we give immunization to anybody, we have to rule out certain things. That is why I asked you about the background state of health of Rick. Is anyone in your family that has a background history of epilepsy?
No, not as far as I know.
Okay. Is anyone that has, you said Rick does not have any form of allergy? Is
No.
that correct?
Yeah, he
So,
does not have.
okay. So, flu vaccine is, do you know
Mhm.
what flu vaccine does? Do you know what it prevents?
Yeah, I know it prevents flu.
Okay. Now, the alternative of not doing this flu vaccine is that he may come down with flu, which can give room for other more serious problems to enter his body and which may cause him to be sick and be hospitalized. Do you understand me?
Oh, okay. Makes sense.
So I think it is best that he receive this vaccine. It will offer protection for him and it will even relieve you of the worries and anxiety of nursing a sick child.
Okay.
Do you have any objections to this?
I just want to ask a few questions. Like, you're sure that flu vaccine does not cause fits, right?
No, there is no research that has been done conclusively that has linked
Okay.
flu vaccine with fit. It's not
Okay.
true. And besides,
Okay.
millions of children all over the world, including this country, have received this vaccine, and there is no adequate evidence that points to flu vaccine as a cause of epileptic fit.
Okay. And what side effects can this cause, though?
Well, thank you. Initially, after the receiving the jab, the boy may have
minutes remaining.
slight irritation or increase in his temperature, which can be controlled by just giving paracetamol.
Okay.
And after a day or two, he will get over it.
Okay. And
So
that's all. There's no other side effects, right?
there's no any serious side effects. In as much as we have ruled out that he does not have a background history of seizure, he does not have high temperature at the point that the jab will be given, and we are satisfied that is fit for the jab, we will give him. So any minor reactions that he may take can be controlled by giving analgesic, or if he's reacting, we may give him antihistamines. Then after 2 or 3 days, he will get over it. However, I will give you leaflets where you can read more about this flu vaccine. I'll direct you to NHS website where you can read more about it. Then
Okay.
if there is any problem, if there is weakness in the limb where you receive the vaccine, or if there is swelling around the place of injection, you can, or there is discharge from the point of injection, please, you need to bring him back so that we'll look at it very well.
Okay.
Is that okay
Sure.
with you?
Yeah, sure. Thank you. That sounds good.
I will
But
advise that
it's compulsory.
I will advise that you bring Rick so that I examine him, and once we are satisfied with his condition, he will be certified fit to receive the jab.
Okay. Okay. But is this compulsory, though?
It is best that you take it as to protect you and protect other children.
Okay.
Move on to the next station.
How do you think it?
Yeah, it's fine. It's it's immunization. It's about counseling on immunization.
Yeah. Not bad. You actually covered most of the things. That was really good. And yeah, I think I was being a little more, cooperative patient. But yeah, there might not always be, because
Yes.
especially these cases where they're so it's kind of a treatment refusal station where the patient does not want the treatment that is recommended. And yeah, so these are the ones you have to be a little careful about, because they'll be very adamant about it. No, they're not wanting it. So the main thing in this is you have to make sure that they understand what are the consequences of not receiving the treatment. So that point you have to be very clear about. You have to iterate it to the examiner as well. Basically, examiner needs to understand that you are checking that point. Whether are you asking them, do they know what is going to happen if they don't receive the vaccine? All right, that's a very important thing. So it's the same with any treatment refusal.
Okay.
And yeah, I think other than that, you've asked all the things.
Hi, Dr. Kiran. So
Thank
I
you.
had a little point that I wanted to add. You were fixating a lot on the epilepsy. So this is something that has happened to some other child. So you're actually fixating a lot about, the family history of epilepsy. Instead, you should be asking about what are the contraindications of giving the flu vaccine to the child. So if he has any egg allergy, any neomycin allergy, you don't give this, right? So instead of asking about his fit and his problem, because this is a hoax that they have, this is a misconception this lady has. Your whole task is to take that misconception, understand why she's having it, because this other child had it, and tell them that there is no evidence that is supporting any relation to fits and this that you mentioned. But there are evidence where we don't give this flu vaccine, and there are conditions where we don't give this flu vaccine, and this is conditions of that, right? So you're trying to educate her about the flu vaccine, nothing about fits, because you don't have any evidence supporting it. You're trying to tell her what the flu vaccine is because she has some idea which is wrong, and you're trying to make that idea, you're trying to rectify that idea.
That's very important. Actually, you didn't check whether Rick is it's safe to give the vaccine to him. That is something that's very important. You didn't really ask much questions about his current state. Like, does he have any known medical conditions? And does
I asked
has
that. I asked
okay.
if he has any medical condition. I asked about allergy.
Okay, allergy is fine, but immunocompromised state, that's also very important. So you have to ask, does he get a lot of, fever and flu a lot of times? Is it very frequently? So immunocompromised state is very important because you can't give in that state. All right, that's important. Done. Checklist is done. Okay, let's just go through the checklist.
Thank you.
So patient's, so this is patient's age, the mother's age I said, but you didn't ask me the child's age.
Ooh, because I saw it in the.
Yeah, whatever is in the question, you should always confirm. That's very important because what is written in the question is basically what is in the records, hospital records. That might be wrong. So you should
Yeah,
always confirm it with the patient. That's important.
you're right.
Then,
You're right.
yeah, and establish reasons for visit. That's good. Ask about current condition, any fever, flu-like symptoms, diarrhea, vomiting. So if there is any infection currently going on, then also we don't give, right? That's also important. So if the kid is sick right now, we don't give the vaccine. That's important. And this is very good. You asked about pregnancy, birth history, developmental history. That's very good. And allergies and medical history you asked. That's very good. And understanding of the flu vaccine and specific concerns. That's really good. You asked very well. And contraindications for flu vaccine. This is very important. Only allergies you asked, but ask about immunocompromised state. That's very important for any vaccine. Always ask about immunocompromised state. Then, so explain what the vaccine, how the vaccine works. So you need to, so they might think it's some kind of chemical, that can cause these side effects and things like that. So if you explain that it's a weakened form of the virus, which will help the, child's immune system develop, a resistance against it. That's a very simple way to put it. That way they'll understand, okay, it's basically this virus only, but it's weakened, because that invite more questions also from the parent, where the parent can ask, why are you giving the virus to him? What if he gets the flu from the thing? That's also possible, right? There are cases where the vaccine itself causes the disease that it's supposed to give in against. So that's also a very important side effect that can happen. So that is something that you can address if you mention that. And other than that, how is it given? So that's also important. So this is a nasal vaccine. I mean, if you're not sure about it, don't bring it up. It's fine. But yeah, it's a nasal vaccine. And highlight that it protects against flu, and post-vaccination, there are flu-like symptoms. You need to mention that. So you said irritation, but that's just if there is any anaphylactic allergic reaction. But there are certain flu-like symptoms that can happen as well, like after giving the vaccine. That's important because otherwise they might, if you don't tell them that, they might think that you've given them flu by giving the vaccine. So you need to be very sure. You need to explain that this can happen, but it's not flu. It's just body getting used to the thing. It's developing a immunity towards it, and it does not cause fits. That's very important. You explained it really well, and so mild side effects you mentioned. That's good, and it prevents serious infections. That also you mentioned. Just make sure you mention what infections they are. So it's very specific, right? So it's against infections like pneumonia, bronchitis, and ear infections. And reassurance, safety leaflets you mentioned. That's good. So compulsory status, that's also it. You didn't have much time for it because I brought it up at the end. But so usually when they refuse it, if they refuse it, if they refuse it, what are you gonna do? Will you force them for it, or will you tell them that it's okay?
We can't force them to take any medical treatment. We can only persuade them.
Yeah, that's good. Yes. That's something that you should know. So it's not compulsory, although there are vaccines which are compulsory as well. Like for example, there are vaccines like MMR, so which is supposed to be given, but still you still can't force them to give. So you need to tell them that. So there are vaccines which are optional. There are vaccines which are compulsory, but still you can't force them to take it. You have to tell them why it is compulsory, because it can cause issues to other children, right? Flu is something that can't cause issues to other children, so it's not a big deal. Whereas for example, measles, if they get measles, they are disrupting the herd immunity. That's a whole whole thing about vaccines, where the entire community can be at risk. That's also very important. And yeah,
I just like to add on a point to that. So whenever there is a treatment refusal, always give the effects, like always try to highlight the benefits over the risks. So say that what are the benefits, like even if sometimes it can come with an MMR refusing. So now think about all the MMR, like the orchitis that can be happen, mumps orchitis that can happen. There could be like very serious infections later on in life, which it will be very hard for the child to bear later on in life. So this, we are trying to avoid that, and instead they will be having some immune reactions while you get this, and those risks are relatively less compared to the complications that can arise if the child has this infection. So that is one way that you can highlight, benefits over the risks. Always highlight that.
And one more small thing that I noticed was, if the patient interrupts you in between, let them speak. So you stop speaking and let the patient speak, and then you can bring up your point later. So I mean, it might be a little difficult in a phone call, telephone, a video call right now, but in real life also be very careful. Sometimes they do interrupt you. Just let them speak. Don't speak over the patient. That's very important.
Okay, thank you.
Yeah, this it's fine. It's an easy pass. Good.
Yeah. But on that note, on speaking over the patient, I actually marked you on listening, because what exactly happened in the beginning of the station was, as soon as the patient came with the concern of that I don't want the vaccine, the first thing that you should ask is why not, right? That should be the immediate follow-up question. You're trying to understand why. Instead, you went to asking the P-binds question, the pregnancy, immunization, and birthing history. At this point, you don't want to know all that. You want to know what is the purpose of this visit. Immediately, as soon as they actually bring up a concern saying that I don't want this, I don't like this vaccine, you need to understand why they don't like the vaccine, right? So the first question that you should have asked over there would be, oh, I'm sorry, can you please explain why you have an issue with this vaccine? So once you understand that, you understand your task, you understand what the station is about, and then later on to get so P-binds would actually be similar to P-maftosa. So when do you ask P-maftosa? After understanding the disease itself, right? In this case, you're trying to understand the concern itself. Once you understand the concern, then you understand a little bit more about the child, right? Then you should have asked the P-binds, because at this point, that's why I gave a mark for, I gave a tick for listening, because you never answered that question immediately. You answered it later on, But immediately as soon as you say that I have concerns with this vaccine, immediately ask, what are your concerns? Can you please explain your concerns so I can understand your issues better, right?
I understand you. Thank you.
All right. Yep, we go to the next question.
Please like and subscribe to TuringMedSchool. Good luck with your preparation.